Okay, thank you, Mr. Chairman. I'm conscious that we are short of time, so I don't want to hold you back too much from your coffee, and I'm just going to try and introduce you to a new product which has become recently available, and our recent experience in Southampton on using this particular hemostat. This is my financial interest. So bleeding in aortic surgery is, of course, a challenge, and this challenge arises because there are both patient and operative factors, and often patients that we're dealing with today, both in cardiac and vascular surgery, are elderly. They have degenerative tissues, and not invariably they can be on anticoagulants and antiplatelet agents, and may indeed have to endure urgent and emergent operations. These operations are often complex. They can be long in terms of both operative times and bypass times, and can involve significant cooling. Suture lines are often quite complex, and conduits and grafts employed in themselves inherently can be also non-hemostatic. So I think the benefits of hemostats are clear, because the use of hemostats have grown substantially over the last 10 years, and the use of hemostats have been driven by the need to try and reduce transfusion times, operative times, and of course now we have the introduction of increasingly more minimally invasive surgery, and hemostats may have a significant role to play in this area. This is quite a busy slide, but it serves to demonstrate that there is no ideal hemostat, and that's why there are so many agents available currently on the market. And any ideal hemostat should, of course, be safe, it should be effective, and it should be easily usable, and of course it should have some bearing on costs and the effectiveness of that agent. I've just ringed in red some of the agents that we currently use in Southampton. I think that these are quite popular agents. They all have their advantages and disadvantages, but often, certainly in our experience, we end up using more than one agent. The particular product we're talking about today is Puristat. It's relatively new. It does have a CE mark, and I think it's a little bit novel in that it's based on nanotechnology in terms of its mode of action. And the other perceived advantage is that it is totally non-biogenic and biocompatible. Its mode of action is quite interesting in that it comes as a synthetic peptide solution, and when it's exposed to blood, the pH becomes gradually more neutral. It undergoes conformational change, which exposes the peptides to ions in the blood, particularly sodium, and that triggers the self-assembly of beta-pleated sheets, which then become nanofibers, and then you're left with a sort of a hydrogel which provides a cover, which then provides the right environment for normal hemostasis to occur beneath. It comes in different sizes between 1 and 5 mils, and our own experience is quite limited at the moment. We've only had it for a couple of months, and we've been evaluating just a sort of observational evaluation to start with in various types of cases. And one of the nice things about it is that you can actually use it both before and after the application or the reversal of heparin. I don't know if this video is going to run because probably it's Mac based, but it just shows some of the more complex applications. We've used it on valve sparing routes, and there's a Thoraflex graft on the right. You can apply it very readily to suture lines, and it begins to work within a couple of minutes, and it seems to be quite effective for suture line bleeding. The variety of cases we've done are quite variable, from simple aortic work all the way to more complex work, and its assessment would suggest that it's certainly very easy to use. It can be reapplied, and in just 1 or 2 cases we've actually used it in combination with other hemostats, in this case Fibrillar, and it seems to be effective in stopping bleeding. So from our point of view at the moment, it seems to be a nice product. It's, as I said, because it's synthetic, it has no potential for causing allergic reactions, And it is very simple. There's no preparation. It comes straight out of the fridge, and it's handed to the surgeon, and you can use it very simply. And because it's transparent, it doesn't block where the potential site of bleeding is, so additional sutures can be applied. And of course, any hemostat is no substitute to good surgery and good suture placement. And the other, I think, important points about this is the fact that it can be used in any type of conduit. You may be aware that if you're using a bi-integral bioconduit, you can't use bioglue because of the formaldehyde content, and this particular hemostat can be used in any setting. So really that's all I have to tell you at this stage about hemostat. We're obviously going to take it further and move on to some comparisons with existing hemostats available on the market so we can actually define its true efficacy. Thank you for your time.